Hi, Mike Bentz here at University of Wisconsin Plastic Surgery in Madison to discuss the paper, A Randomized Controlled Trial of Virtual Reality in Awake Minor Pediatric Plastic Surgery Procedures. As a pediatric plastic surgeon, our goal is to have any procedure, particularly in the awake child, as anxiety-free and pain-free as possible, which includes trying to keep the anxiety level down in the parents. In this paper, Dr. Clerc, Arneja, Zwimpfer, Behboudi, and Goldman from British Columbia sought to answer the question, can virtual reality alleviate pain and anxiety as compared with our standard anti-anxiety approach, including DVDs, music, books, and iPads. This was designed as a randomized control study, which means that the individual kids participating were picked randomly to avoid bias, and the control part was the kids that got virtual reality had an age match similar for our standard approach. So there was apples to apples comparison. 67 children between the ages of 6 and 16 were involved in this study, which was approved by the research group at British Columbia. And this approach help decrease bias and also lead to reliable results as others look to apply their success. Virtual reality was applied in roughly half the kids, and all the kids afterwards got to play with it, so everybody had a benefit of the approach. Interestingly, studying various metrics related to this experiment showed that younger children benefited more than older children in the group, and particularly those less than 10. Unexpected finding was the length of the procedure decreased, so the procedures were quicker, which can lead to surgical efficiency. There was no significant decreased statistically in the patient's pain or anxiety, but they did show that virtual reality in this application is safe, and the patients described it as fun. As we look to continue to optimize the experience a pediatric patient is involved with and what they see and feel during outpatient procedures when they're awake, this is another tool in our armamentarium that hopefully will help both patients and families alike. I appreciate the thoughtfulness of this author group and applying evolving and new technologies as we seek to optimize our care of our pediatric patients.